Hereditary diseases are illnesses passed down through families. Imagine a family recipe book. Recipes, like genes, are instructions passed from one generation to the next. Just as a recipe determines the outcome of a dish, genes influence our traits, including our risk for certain diseases. These diseases are caused by changes in our genes, the building blocks of inheritance. These changes can be small, affecting a single instruction in the genetic code, or large, involving entire sections of genes. Regardless of the size, these alterations can have a significant impact on our health. These diseases are not contagious like the flu or a cold. You cannot catch them from someone else. They are passed down through families, much like hair color or height. Understanding this inheritance pattern is crucial for families who may be at risk. It's important to remember that having a gene for a hereditary disease doesn't always mean you'll develop the condition. It just means you have a higher chance. Factors like lifestyle, environment, and other genes play a role. Genes are like tiny instruction manuals found inside almost every cell in our body. They are made of DNA, a long spiraled molecule that carries our genetic information. Think of DNA as a ladder, with each rung representing a specific code. This code determines our traits, from eye color to our risk for certain diseases. We inherit half of our genes from our mother and half from our father. This explains why we often resemble our parents or siblings. Just like we inherit physical traits, we can also inherit changes in genes that cause diseases. These changes, known as mutations, can be inherited from a parent or occur spontaneously. Sometimes these mutations are harmless, other times they can disrupt the normal function of genes, leading to health problems.
The Human Genome Project, completed in 2003, was a groundbreaking effort to map out all the genes in the human body. This project has revolutionized our understanding of hereditary diseases and paved the way for new diagnostic and treatment options.
Hereditary diseases can affect almost any part of the body. Some are present at birth, while others may not appear until adulthood. They can range in severity from mild to life-threatening.
One type of hereditary disease is caused by mutations in a single gene. These are called single-gene disorders. Examples include cystic fibrosis, sickle cell anemia, and Huntington's disease. Another type is complex diseases, which involve multiple genes and environmental factors. These include heart disease, diabetes, and some types of cancer. Understanding the interplay between genes and environment is crucial for developing effective prevention strategies.
Advances in genetic testing have made it possible to identify individuals who carry genes for certain hereditary diseases. This information can be empowering, allowing individuals to make informed decisions about their health and family planning. Section 4, Common Hereditary Diseases. A closer look. Let's delve deeper into some common hereditary diseases.
This disease affects the lungs and digestive system, causing thick mucus to build up in these organs. It is caused by a mutation in the CFTR gene.
This neurological disorder causes progressive damage to brain cells, leading to movement, cognitive, and psychiatric problems. It is caused by a mutation in the HTT gene.
This blood disorder affects red blood cells, causing them to become misshapen and leading to anemia, pain, and other complications. It is caused by a mutation in the HBB gene.
These are just a few examples of the many hereditary diseases that can affect individuals and families. Each disease has its own set of symptoms, inheritance patterns, and treatment options. Section 5. Genetic Counseling, Navigating the Path Forward. Genetic counseling plays a crucial role in helping individuals and families understand and cope with hereditary diseases.
Genetic counselors are healthcare professionals trained to evaluate family history, assess disease risk, and provide support and guidance. They can help you understand your chances of having a child with a genetic condition, the benefits and limitations of genetic testing, treatment options and clinical trials, and resources and support groups.
Genetic testing can be a valuable tool for identifying genetic mutations. It involves analyzing a sample of blood, saliva, or tissue to look for specific changes in genes. This information can help confirm a diagnosis, predict disease risk, and guide treatment decisions.
Section 6. Conclusion: Knowledge is power. Understanding hereditary diseases is essential for improving healthcare outcomes. By learning about our family history, being aware of potential risks, and seeking appropriate medical advice, we can take proactive steps to manage our health and that of our families. Remember, knowledge is power. By staying informed, seeking genetic counseling when needed, and supporting research efforts, we can work towards a future where hereditary diseases are better understood, effectively treated, and potentially prevented.